The movement I will be analyzing is the baseball pitch. Here's the total movement in real speed. Now I will be breaking down the movements into 5 different phases. The stance, the prep phase, which is divided into 2 segments, the cocking segment and the wind-up, the movement phase, the follow-through, and the recovery phase. First, the stance phase. In this phase, the pitcher stands near anatomical position with elbow flexion, slight internal rotation of the shoulder, and pronation on both sides. The muscle agonists with elbow flexion, contracting concentrically, are the biceps brachii, brachialis, and brachioradialis. The muscle agonists with internal rotation of the shoulder, contracting concentrically, are the pectoralis major, subscapularis, anterior deltoid, latissimus dorsi, and the teres major. Lastly, the muscle agonists with pronation, contracting concentrically, are the pronator teres and the pronator quadratus. Second, the prep phase. I'll be breaking this down into 2 segments referred to the cocking and the wind-up. In the cocking segment, there is hip flexion of the left hip, knee flexion of the left knee, as well as slight knee flexion in the right knee, plantar flexion of the left ankle, internal rotation of the right hip, and minor right trunk rotation. The muscle agonists with the left hip flexion, contracting concentrically, are the right psoas major, right psoas minor, right iliacus, right rectus femoris, right sartorius, and the right pectineus. The muscle agonists with right knee flexion, contracting concentrically, are the right sartorius, right semitendinosus, right semimembranosus, and the right biceps femoris. The muscle agonists with left knee flexion, contracting concentrically, are the left sartorius, left semitendinosus, left semimembranosus, and the left biceps femoris. The muscle agonists with plantar flexion of the right ankle, contracting concentrically, are the right gastrocnemius, right soleus, right tibialis posterior, right flexor digitorum longus, right flexor hallucis longus, right peroneus longus, and the right peroneus brevis. The muscle agonists with internal rotation of the right hip, contracting concentrically, are the right gracilis, right semitendinosus, right semimembranosus, right gluteus minimus, anterior right gluteus medius, and the right tensor fasciae latae. The muscle agonists with right trunk rotation, contracting concentrically, are the right internal oblique, left external oblique, right erector spinae, right iliocostalus, right longissimus, and the right spinalis. In the wind-up segment, there is left hip extension, left knee extension, left hip abduction, abduction of both shoulders, upward rotation of both scapulae, external rotation of both shoulders, extension of both elbows, and left neck rotation. The muscle agonists with the left hip extension contracting eccentrically are the left bicep femoris, left adductor magnus, left semitendinosus, left semimembranosus, and the left gluteus maximus. The muscle agonists with left knee extension contracting eccentrically are the left rectus femoris, left vastus intermedius, left vastus lateralis, and the left vastus medialis. The muscle agonists with left hip abduction contracting concentrically are the left sartorius, left gluteus medius, left gluteus minimus, and the left tensor fasciae latae. The muscle agonists with the abduction of both shoulders contracting concentrically are the deltoids, pectoralis major, coracobrachialis, and the supraspinatus. The muscle agonists with upward rotation of both scapulae contracting concentrically are the serratus anterior and trapezius. The muscle agonists with external rotation of both shoulders contracting concentrically are the posterior deltoid fibers, infraspinatus, and the teres minor. The muscle agonists with extension of both elbows contracting concentrically are the triceps brachii and the econius. The muscle agonists with left rotation of the neck contracting concentrically are the right sternocleidomastoid, left splenius cervicis, left splenius capitis, left iliocostalis, longissimus, and spinalis. One common incorrect technique occurs in this phase. The left hip in the wind-up phase externally rotates too far, which takes away the torque in the hips. To help in correcting this technique, have a straight line from your feet to the plate to make sure you don't externally rotate too far. Next, the movement phase. In this phase, there is left dorsiflexion, right plantar flexion, left hip adduction, right hip abduction, right knee extension, left hip internal rotation, right hip external rotation, left trunk rotation, right horizontal adduction of the arm, and right arm extension. The muscle agonists for left dorsiflexion of the ankle contracting concentrically are the left peroneus tereis, left extensor digitorum longus, left extensor hallucis longus, and the left tibialis anterior. The muscle agonists for right plantar flexion of the ankle contracting concentrically are the right gastrocnemius, right soleus, right tibialis posterior, right flexor digitorum longus, right flexor hallucis longus, right peroneus longus, and right peroneus brevis. The muscle agonists for left hip adduction contracting concentrically are the left pectineus, left adductor brevis, left adductor longus, left adductor magnus, and left gracilis. The muscle agonist for the right hip abduction contracting concentrically is the right sartorius. The muscle agonists for right knee extension contracting concentrically are the right rectus femoris, right vastus intermedius, right vastus lateralis, and right vastus medialis. The muscle agonists for internal rotation of the left hip contracting concentrically are the left gracilis, left semitendinosus, and left semimembranosus. The muscle agonists for right hip external rotation contracting concentrically are the right iliacus, right psoas major and minor, right pectineus, right biceps femoris, right gluteus maximus, right piriformis, right gemellus superior, right gemellus inferior, right arbitrator internus, right arbitrator externus, and right quadratus femoris. The muscle agonists for left trunk rotation contracting concentrically are the right internal oblique abdominal and the left internal oblique abdominal. The muscle agonist for right horizontal adduction of the shoulder contracting concentrically is the right biceps brachii. The muscle agonists for right arm extension contracting concentrically are the right triceps brachii long head, right triceps brachii lateral head, right triceps brachii medial head, and the aconius. Now the follow-through phase. In this phase, there is horizontal adduction of the right shoulder and extension, left shoulder adduction, left elbow extension, right hip extension, left external rotation, right knee flexion. The muscle agonist for horizontal adduction of the right shoulder, contracting concentrically, is the right biceps brachii. The muscle agonist for right shoulder extension, contracting concentrically, is the right triceps brachii. The muscle agonist for left shoulder adduction, contracting concentrically, is the left triceps brachii. The muscle agonists for left elbow extension contracting concentrically are the left triceps brachii and left aconius. The muscle agonists for right hip extension contracting concentrically are the right biceps femoris, right adductor magnus, right semitendinosus, right semimembranosus, and the right gluteus maximus. The muscle agonists for the left external trunk contracting concentrically are the right internal oblique abdominal and the left internal oblique abdominal. The muscle agonists for right knee flexion contracting concentrically are the right sartorius, right semitendinosus, right semimembranosus, and the right biceps femoris. The last phase is recovery. In this phase, there is right trunk rotation, both knee and hip flexion, right shoulder external rotation, and supination of both wrists. The muscle agonists for right trunk rotation contracting concentrically are the left internal oblique abdominal and the right internal oblique abdominal. The muscle agonists for flexion of both knees contracting concentrically are the sartorius, semitendinosus, semimembranosus, and the biceps femoris. The muscle agonists for flexion of both hips contracting concentrically are the psoas major and minor, the iliacus, rectus femoris, sartorius, and the pectineus. The muscle agonists for right shoulder external rotation contracting concentrically are the right posterior deltoid fibers, right infraspinatus, and the right teres minor. The muscle agonists for supination of both wrists contracting concentrically are the biceps brachii and supinator. Lastly, there are three important biomechanical principles associated with this movement. Torque is a twisting force that causes rotation. As you increase torque, you can increase the power. Balance is important for the accuracy of the pitch. The more balanced you are, the easier it is to throw accurately. Acceleration, the greater the acceleration you have, the faster the pitch will go.